Stomach pain, sometimes associated with other symptoms like nausea, vomiting, excessive gas, or bloating, is not all that uncommon. In most cases, stomach pain is related to something we either ate, such as with food poisoning, caught like the stomach flu, or experience routinely, such as bloating during the menstrual cycle. At other times, a problem that causes stomach pain can appear out of the blue and for no apparent reason. If this happens and the symptoms are either severe, persistent, or worsening, you need to see a doctor to investigate the cause. Diagnosing the why behind your stomach pain entails a comprehensive medical history and physical examination, and oftentimes, imaging, like an ultrasound or CT scan of your abdomen. In some cases, an endoscopy will need to be performed, which is a procedure performed by a gastroenterologist to better visualize the digestive tract. Once a diagnosis is made, your doctor can proceed forward with a treatment plan, which may involve a combination of therapies like lifestyle changes, medication, or surgery. Causes. Typically speaking, stomach pain that occurs in the abdomen nearer to the ribs involves the upper gastrointestinal (GI) tract, which includes the esophagus, stomach, and small intestines. Pain occurring in the lower abdomen tends to be related to the lower GI tract, which is comprised of the large intestine, colon, rectum, and anus. Upper gastrointestinal tract. Besides your run-of-the-mill stomach bug or the occasional bout of indigestion, here are some health conditions that cause more persistent stomach pain in the upper gastrointestinal tract. Esophagitis. Your esophagus is the tube that carries food from your mouth to your stomach. Esophagitis refers to irritation and inflammation of the lining of the esophagus, which may occur for many reasons including infection, for example, Candida or the herpes simplex virus, taking certain medications, for example, the antibiotic clindamycin or aspirin, from an allergy called eosinophilic esophagitis. Besides heartburn and upper belly pain, a person with esophagitis may notice difficulty swallowing and/or pain with swallowing. Gastroesophageal reflux disease. Gastroesophageal reflux disease (GERD), also known as acid reflux, is a condition in which stomach acid leaks back into the esophagus, causing a burning sensation in the chest or throat. Besides heartburn, some other symptoms of GERD include regurgitation, trouble swallowing, stomach pain, hoarseness, cough, or feeling like there is a lump in the throat. Peptic ulcer. Peptic ulcer is a term used to describe an open sore in the stomach or duodenum. The symptoms can vary but often include pain, indigestion, nausea, vomiting, and excessive gas. Most peptic ulcers are caused by either the bacterium Helicobacter pylori (H. pylori) or the use of nonsteroidal anti-inflammatory (NSAIDs), which may irritate and alter the protective mucosal layer of the digestive tract. Gastritis. Gastritis is the medical term for the inflammation in the lining of the stomach. Gastritis is a far-ranging condition caused by everything from alcohol to NSAID use to infection with the bacteria H. pylori. In some cases, the condition will be idiopathic, meaning no cause is ever found. Besides pain in the upper belly, other symptoms of gastritis include feeling bloated, early satiety, decreased appetite, nausea, and vomiting. Gastroparesis. Gastroparesis is a condition in which the stomach is slow to empty its contents into the small intestine. This condition is common in people with diabetes, but may also occur idiopathically, meaning there is no clear reason why it develops. Besides abdominal pain, other symptoms of gastroparesis include nausea, a feeling of fullness, and vomiting after eating. In severe cases, a person may lose weight. Gallstones. Gallstones are caused by the crystallization of bile in the gallbladder. This may lead to the formation of jagged, little stones that block the bile duct and cause severe pain in the upper right abdomen, a condition called acute cholecystitis. There are numerous complications of gallstones, like pancreatitis or acute cholangitis, that may worsen your pain and/or cause other symptoms. Pancreatitis. Pancreatitis refers to inflammation of your pancreas, a small gland that releases insulin to regulate your blood sugar levels and also aids in the digestion of fat. Alcohol and gallstone disease are the two most common causes of pancreatitis. Most people with acute pancreatitis develop severe, constant pain in their upper belly. Celiac disease. Celiac disease is an autoimmune disorder in which the consumption of gluten causes the immune system to attack the small intestine. In addition to abdominal discomfort, other symptoms of celiac disease including diarrhea, weight loss, and excessive gas. Lactose intolerance. Lactose intolerance is a condition in which a person lacks the enzyme needed to digest the sugars found in dairy products. People with lactose intolerance will typically experience diarrhea, gas, or bloating soon after eating foods like milk or cheese. Both upper and lower gastrointestinal tract. Some health conditions that cause stomach pain may affect both the upper and lower digestive system. Inflammatory bowel disease. Inflammatory bowel disease (IBD), which includes Crohn's disease and ulcerative colitis, manifests with a wide range of gastrointestinal and non-gastrointestinal symptoms. The hallmark symptoms of Crohn's disease include crampy abdominal pain along with non-blood diarrhea, while the cardinal symptoms of ulcerative colitis include colicky abdominal pain and bloody diarrhea. Keep in mind, while Crohn's disease may affect the entire GI tract from mouth to anus, ulcerative colitis only affects the lower GI tract, colon and rectum. Irritable bowel syndrome. Irritable bowel syndrome (IBS) is characterized by a cluster of symptoms including stomach pain, constipation, or diarrhea for which there is no evidence of underlying damage. Cancer. While less common, upper and lower abdominal pain may be a sign of cancer. Be sure to see your doctor if your pain is persistent and/or you are experiencing other unusual symptoms like a change in bowel habits, blood in your stool or urine, excessive fatigue, or unexplained weight loss. Lower gastrointestinal tract. Here are some of the more common health conditions that arise within the colon and/or rectum. Diverticulosis. Diverticulosis refers to the development of little pouches within the lining of the colon. Infection and inflammation may lead to symptoms ranging from lower abdominal tenderness to severe pain, fever, nausea, and vomiting. Constipation. Constipation is very common, and while it does not usually cause pain, it may lead to discomfort, associated with abdominal bloating from excess gas. Some people with constipation also note very hard or small stools, increased straining, or a feeling that their bowels do not completely empty. Appendicitis. The most common symptom of appendicitis is abdominal pain, which usually begins around the belly button. Over time, the pain moves to the right, lower part of the abdomen. Other associated symptoms include a loss of appetite, nausea, and vomiting, and fever. Abdominal hernia. An abdominal hernia, which may cause stomach pain and a visible bulge, occurs when fatty tissue or an organ herniate or poke through a weak or torn area within the abdominal wall. There are different types of abdominal hernias. An umbilical hernia occurs around the belly button while an epigastric hernia occurs above the belly button. When to see a doctor. If you ever have sudden and severe stomach pain, seek immediate medical treatment. Other symptoms that warrant obtaining medical attention right away include chest pain, vomiting up blood or dark-colored flecks, having black, maroon, or bloody stools, severe and/or persistent constipation, new onset pain or swelling around an abdominal hernia site, dizziness and/or feeling faint, unable to keep down food or fluids. Diagnosis. Besides a thorough medical history and physical examination, which entails your doctor listening to your abdomen with a stethoscope and pressing on different areas to evaluate for tenderness or abnormalities like swelling, rigidity, or masses, other tools are usually utilized to confirm the diagnosis. Blood tests. Depending on your suspected condition, your doctor may order one of many blood tests. For example, if your doctor suspects gallstones, you will undergo a liver function and bilirubin blood test. Other blood tests that may be ordered include celiac disease, antibody blood test called IgA, tissue transglutaminase, inflammatory bowel disease, complete blood count and inflammatory markers like C-reactive protein (CRP), pancreatitis, the pancreatic enzymes, amylase and lipase. For a diagnosis of peptic ulcer disease, your doctor will want to test you for H. pylori infection, which is a common cause. You may be tested for H. pylori through an endoscopic biopsy of the stomach, performed during the upper endoscopy, a urea breath test, or a stool H. pylori antigen test. Imaging. Several imaging tests may be used to evaluate the why behind your stomach pain, including an abdominal ultrasound and a CT scan. Two other tests you may not be as familiar with include a barium swallow test and an upper endoscopy. Barium swallow. The barium swallow test is an X-ray imaging test sometimes used to evaluate disorders of swallowing, stomach ulcers, and hiatal hernia. During this test, a person drinks a thick liquid called barium while X-rays are taken, allowing the esophagus and stomach to be visualized clearly. Upper endoscopy. In order to confirm a suspected or potential diagnosis, your doctor may refer you to a gastroenterologist, a doctor who specializes in treating diseases of the digestive tract, for an upper endoscopy. During an upper endoscopy, while you are sedated, a gastroenterologist inserts a long tube with a camera attached to it into your mouth and down through your esophagus into your stomach. Not only can your doctor visualize the inside of your upper digestive tract and look for abnormalities, but he can also use surgical tools passed through the tube to take tissue samples, biopsy. Differential diagnosis. It's important to note, stomach pain very well may not be stemming from the GI tract, but rather from another system. For example, stomach pain can be easily confused with chest pain. In the event of unexplained chest pain or stomach pain without other classic gastrointestinal symptoms, heart disease absolutely needs to be considered. In this case, an electrocardiogram (ECG), exercise stress test, and cardiac enzymes may be ordered. On the same note, lower stomach or abdominal pain may actually be a source of pelvic pain, so could be a symptom of an ectopic pregnancy, ovarian cyst rupture or torsion, pelvic inflammatory disease, endometriosis, fibroids, as well as a urinary tract infection, kidney stone or infection, amongst others. Likewise, upper stomach or abdominal pain could stem from the lungs and be a symptom of pneumonia or pulmonary embolism. Keep in mind, the above list of stomach pain causes is not exhaustive. In the end, don't make the diagnosis of your stomach pain on your own. Seek out a proper diagnosis and treatment plan from a healthcare professional. Treatment. As you probably expect, the treatment of stomach pain depends on the underlying diagnosis. Lifestyle treatment options. Several lifestyle modifications may help you manage your doctor. For example, in the case of celiac disease, a strictly gluten-free diet is paramount to treating the disease, just as restricting lactose, milk products, ingestion is how most people manage lactose intolerance. Treating GERD may require several lifestyle changes, such as losing weight if you are overweight or recently gained weight, elevating the head of your bed, for example, placing a styrofoam wedge underneath the head of the mattress, avoiding meals 2 to 3 hours before going to bed. Lifestyle behaviors are also at the crux of treating constipation and include eating foods high in fiber like prunes and breakfast cereals, drinking 6 to 8 glasses of water per day, engaging in daily physical activity. Medications. Some gastrointestinal related conditions can be managed with over-the-counter or prescription medications. Acid-reducing medications. While your run-of-the-mill occasional heartburn may be treated with over-the-counter antacids like Tums, Maalox, and Mylanta, the treatment of GERD, peptic ulcer disease, and gastritis requires taking a medication called a histamine blocker (H2 blockers) or a proton pump inhibitor (PPI). Laxatives. For constipation-related stomach discomfort, laxatives may be recommended by your doctor, if lifestyle changes are not helping. Be sure to discuss which laxative to take with your doctor, as they work differently and some may not be safe for you. Steroids and immunosuppressants. Treatment of inflammatory bowel disease may involve steroids and immunosuppressants to slow the progression of the disorder. Surgery. While surgery is the first-line treatment for some gastrointestinal conditions, like appendicitis or symptomatic gallstones, it may be the last resort options for other gastrointestinal problems, for example, a surgery called a Nissen fundoplication for refractory GERD. A word from Verywell. When a stomach problem develops fast and furiously, our minds will often go the worst possible cause. More often than not, there will be less a troubling explanation, although it may require chronic treatment and/or a significant change in diet.